Welcome to Oral and Maxillofacial Surgery of the Panhandle Region. If you have been scheduled to have a tooth or multiple teeth extracted, it will be important to follow these instructions exactly as we present them. Change the gauze you are biting on when you arrive home. Take a single piece, fold it in half, and then fold again into a small, tight pad. Place pack directly over the surgery site, one on each side of the mouth, and bite down with firm pressure to control the bleeding. Keep the gauze packs in place for approximately 2 to 3 hours following surgery, changing every 30 minutes to 1 hour. Remove packs to drink and replace them with clean packs. Do not spit. Spitting only prolongs bleeding. The length of time that you will have bleeding varies from patient to patient, but could persist until the day following surgery. If profuse bleeding or any other problems occur, please contact our office. For the first several hours following your surgery, eat cool, soft foods such as Jell-O, pudding, applesauce, ice cream, frozen yogurt, milkshakes, Gatorade, and fruit juices. Do not use a straw to drink thick liquids. The force of sucking could dislodge your blood clots and prolong your bleeding. Do drink plenty of liquids throughout your recovery to avoid dehydration. The evening of your surgery, you may begin to eat soft foods such as mashed potatoes, scrambled eggs, cooked cereals, or soups. Allow these foods to cool down significantly first to avoid additional bleeding. You may return to your regular diet, adding regular foods daily as you heal. Liquid diet supplements, such as Ensure, contain all of the daily vitamins that your body will need during the healing process. Rinse with warm salt water 3 to 4 times each day. To make the salt water solution, dissolve 1 teaspoon of salt into a small glass of warm tap water. After you have eaten or had something to drink, you may begin to take your medications. Take all prescribed medications as directed until completely finished. Do not drive a car, operate machinery, or drink alcoholic beverages while taking pain medications. If you are using oral contraceptives, it is important that you understand that antibiotics and other medications may interfere with the effectiveness of oral contraceptives. You will need to use an alternative form of birth control for 1 complete cycle of birth control pills after the course of antibiotics or other medications is complete. Rest for the remainder of the day. Elevate your head about 30 degrees. Place an old towel or pillowcase over your pillow, as some drainage is likely while you sleep or turn on your side. Have a responsible caretaker stay with you for the remainder of the day. Apply ice packs to the outside of your cheeks after your surgery, alternating from one side to the other every 15 to 20 minutes. Some degree of swelling, discomfort, discoloration, and a slight stiffness of the jaw is normal, and you should not be alarmed. Maximum swelling occurs within 48 hours following your surgery and may last for several days. Have a responsible adult drive you to the office and stay in the waiting area during surgery, especially if you have had intravenous general anesthesia. Your reflexes, depth perception, and judgment will be altered somewhat for several hours following the procedure, and it will be necessary to have some assistance. Brush your teeth as usual, avoiding the areas of surgery with the bristles of your toothbrush. Warm saltwater rinses, 1 teaspoon of salt in a glass of warm water, may be started the day following your surgery and utilized 3 to 4 times per day to help keep the surgical sites clean and free from food particles. Your stitches will dissolve within 7 to 10 days after surgery. It is normal for small pieces of sutures to come out prior to this time. If the sutures need to be removed, you will be notified and an appointment will be made for you. If you are given IV medication, you may develop some tenderness or bruising around the site of the injection. Apply a warm, wet cloth or heating pad on low heat to the area the day after surgery to ease any discomfort. Do not smoke during your healing process to avoid delays in healing and excess bleeding caused by nicotine. Do not breastfeed for at least 12 hours if you were sedated for surgery. Thank you for taking the time to watch this video. We look forward to seeing you and providing you with the highest level of care at our state-of-the-art facility. Thank you.